Welcome back to my DPC story. Today's episode is a partner episode, and I hope you'll get a lot out of it. What you're about to hear was recorded live in a breakout room right after the California DPC Summit wrapped a few weeks ago. You'll hear Justin Lamb, the CEO of Cool Blue VA, chat with a room full of physicians to talk about getting real help in our practices and in our lives. Because we captured this in a smaller breakout space, the audio is a little more echoey and it gets a little tricky in spots, so thank you in advance for your patience with it. You'll hear me at the very top introducing Justin and sharing a bit about my own experience working with an RN who also happens to be a medical virtual assistant who I was fortunate to find through Cool Blue VA. Then I hand the room over to him. From there, Justin walks through the questions so many of us sit with when we're building a direct primary care practice. When is the right time to hire? What can you hand off? And what is it only you can do? He talks about how to design the role you need before you ever start looking, the real difference between a local medical assistant and a virtual assistant, and what each one is best suited for. And in the end, you'll hear the back and forth with the physicians in the room who ask questions you're probably asking yourself right now. So whether you have a full panel or you're still mapping out your first month, there's something in here worth holding on to. If you want to find out more about how Cool Blue VA specializes in working with DPC practices, head on over to coolblueva.com/DPC Grow or check out the link in the show notes. Now, on to the episode. Justin has worked in this space of virtual assistants in a different way than other people just starting a company. His dad, his sister's a physician, so he understands from the needs of our clients what we're looking for. My VA Marine is, I connected with her through Cool Blue VA, and one of the things that I love about Cool Blue VA and the way they stand out is that they have a very low graduation rate in their program. It's 40%. And so with that, you know it's not just anybody that's going to apply. 3 months in or 4 months in, Cool Blue VA also gives you the opportunity to pay your VA on top of what they're getting paid through Cool Blue VA. And for me, I think that that really is understanding of, yes, overseas nurses, pharmacists, etc., could be cheaper. However, when they're more valuable than the person that I hired straight from California, and I'm like, you are literally helping me grow my practice, I'm able to show that. And with that, I will let Justin take the room. But please, if you have any questions about my experience, always free to check. Enjoy
Thank you. Maryal. All right. Okay, yeah, so very nice meeting you guys. My name is Justin. Man, a quick question here. How many of you guys checked your email inbox today, this morning? I know, that's everybody. A lot of people, right? A quick question. How many people have a practice open right now? How many people are thinking about starting a practice? Okay, so most people are thinking about starting a practice. Okay, fantastic. All right, so yeah, once again, I'm Justin Lamb. I just want to tell you a little bit about the story that Dr. Maryal was talking about. Yeah, my dad is a doctor, my brother and sister are doctors as well. Back in 2020, we started Land Clinic up here in Tustin, actually, and it was right in the middle of COVID. We had open for 2 months, I think, and then the government said everybody has to work from home. And so we really couldn't find anybody to staff the clinic. My sister at that time was actually super stressed out. She was trying to get pregnant too. At the same time, she had been trying for a year, but it was super stressful. I was doing operations at that time. I needed to find a solution. So luckily, I was able to get these nurses, rock stars from the Philippines, to help staff our practice out. And so that's basically how our clinic survived through COVID, basically. So that clinic now is generating $7 million in revenue. 4 years ago, I stepped out of the practice to open Cool Blue VA to help other doctors out. And literally 3 months after my sister got her first VA, she got pregnant. So stress just went away, she could focus, and I was like, yeah, it was kind of a miracle in that essence. So that's what I really want to help you guys out with. You know, so what you guys really signed up for when you guys became doctors is to have a relationship with patients, right? Just help them out, have autonomy and flexibility, right? Practice medicine your way and really build something of your own. That's really what direct primary care is about, right? You're not supposed to be the receptionist, right? You're not supposed to be the marketing team. You're not supposed to be doing IT. You're not supposed to be doing all that and then still seeing patients, all right? And so that's why you need to hire, and that's what you really need to get help for, all right? Research is now showing that 27% of your time is only spent on direct patient care, right? 49% of your time is actually spent on desk work, on admin stuff, and everything else. That's over half your day almost. So at least 2 hours is spent for every 1 hour that you're with the patient. And that's really what you want to cut down on, because your time as a doctor, that's really the most valuable thing that you have, right? That's why you went to 4 years of medical school, to really help other people out, right? And residency. And so, what do you actually need help with when you're starting your practice, right? And this is the number one thing, the number one exercises that I want you guys to do here. What you want to do is think about your day and what are the top 5 things that you spend the most time on in your practice. Now, if you don't have a practice, then that's really, what is the top 5 things that you're spending time on, like getting your practice set up and started? Is that like talking to vendors? Is that trying to build a website? Is that looking at different technologies, right? It could be all that stuff that you're really spending time on that's non-medical tasks that you are doing. You know, is that like chasing people down or like calling the county? That stuff that is taking up your time, that's non-medical related. All right? If you have a practice, that could be like emailing patients back. That could be doing prior authorization. That could be even writing your notes, right? You're not actively seeing patients. All right? So take a little bit of time and think about what are the top 5 things that you could be helping, that you're doing that's non-medical related. Some other things, if you're on social media, you could be on social media, you could be posting on social media, creating graphics. How much time you're actually spending on that would you estimate on a weekly basis? How much time are you spending waiting on hold, waiting to talk to somebody? How much time are you spending online trying to do some research for something? And you can't think of anything, maybe it's stuff that you're doing at home. It takes a lot of time out of your day. Whether it's planning your schedule for your kids, maybe you're planning a date night or something, or coming up with a grocery list, ordering food online, delivery. It could be anything that's taking your time that's not medically related. So this is just some examples that you could have had, right? Responding to patient portal messages, scheduling, rescheduling, sending reminders, chasing labs, right? Referrals and prior authorizations, payment reminders, marketing strategy. Almost all of this can be delegated out. One thing you can't really delegate out is strategy, right? You are the doctor, you're the business owner. You do need to be coming up with a strategy. Now, who executes the strategy can be delegated out. And you can think about it, this is about 15 hours of your work that you can be getting back. So this is kind of what you want to think about and the mindset you want to be getting into when you're starting your practice, when you're thinking about hiring somebody. It's the only you test. Is this something that only you can do? If there's somebody else that can do it, it's probably worth your time that you assign it to somebody else to do it. So only you can diagnose and treat patients. Only you can build a doctor-patient relationship. Only you can do procedures that require a license. Only you as a business owner can do biz dev and strategy, marketing and branding. Something else that people can do, appointment scheduling. Somebody else can do that. You don't have to do that. Patient follow-ups, messages, prior authorizations, entering data into the EHR, prepping the chart beforehand, billing invoice collections. Somebody else can do that. That does not require a medical degree, right? That's only something that you can do. So that's a very good framework of mind to get into when you're starting to get busy and you have to hand stuff off. What is the only thing that you can do? That's what you want to should do. Exercise number 2, what did you give up this week? What patients didn't you get your full attention this week because you were distracted by admin? What did you miss personally maybe? If you're busy, staying late at the office, you're busy following up on paperwork, doing pajama time, what did you potentially miss that you hadn't committed to? Right? Working out, sticking with your diet, and what would you have done differently if someone else had handled that for you? If you're missing out on time with family, if you're missing out on commitments that you made, if you're not taking care of your own health even because you're too busy, then it's something you've got to think about doing to bring in some help, to hire somebody. Yeah, absolutely. You know, that personal time, is super important. You got to be healthy to take care of your patients, right? And then cooking, spending time with your family is super important as well. So what you want to think about then next is when you have stuff that's starting to build up is when's the right time to hire, right? You don't have the skills to hire somebody, right? You don't know anything about social media. It's kind of out of your wheelhouse. You should hire somebody with social media, right? You don't have the time, like you said. You're missing workouts. You're missing cooking and all that stuff. You just don't have the time to do it. And if you don't have the energy to do it, right? If you just get home at the end of the day and you're just plopping on the couch and you need to take a nap for an hour, I mean, you need to get some help, right? You need to get some hires there. So just some quick things to think about when is the right time to hire. These are 3 things that are being considered, right? Typically, you want to hire at 50%. So when your plate is at 50%, you want to hire somebody. You don't want to hire at 100% because that's too late already. You're already too busy. You're not going to have time to train the person, right? And then you're going to get frustrated at them because they can't read your mind. Okay, see? So when you're at 50%, you want to hire somebody maximum 75%, but really at 50%. Think about hiring somebody here already so you don't get burned out, you don't rush the decision, and you don't get the wrong person. Because a lot of times that's going to happen as well. If you're at 100%, the first person that walks through the door is, oh, you're my savior, let's just get this done. But they really want the right person for you, right? You end up hiring the wrong person, they're going to leave you 3 months later, and then you're starting all over again.
That's a good point.
Okay? So make sure you take the time, hire, plan it well, don't rush the decision. And this is exercise number 3, how to design your ideal hire. So we kind of went through what is taking up your time already, right? You can delegate and hand off, right? What is the job title of the person you want to hire and the type of support that you need and the main goal in your practice here. And that's based off of exercise number 1 and what you already is taking up time in your practice, what is taking up time in your life, right? That's also the top 3 to 5 things that you're going to end up delegating to this person to help take over that, right? So you can think about this and see. Tools and softwares, if you guys don't have a practice yet, you don't have to worry about that. If you do have a practice, what EHR are they going to be using? What phone system are they going to be using? What tools, how to communicate? What do you use for communication with your patients? And all that. And lastly, it's hours and expectations. When do you want them to work? It's going to be part-time? It's going to be full-time? Is it 8 to 5? Is it after hours, phone call coverage? What time of the days are they going to work? How are they going to report to you as well? Right? Are they going to email you? Are they going to call you for an update? Are they going to put it on chat to email you and report to you? And see. And then really important is how we measure success. In medicine, everything has a metric, all right? You know what your healthy blood pressure is. What is successful for this person that you're going to hire? What's going to be successful for the virtual assistant? Is it answering 100% of phone calls? Is it making sure that every patient gets connected to and touched to once a day? Is it making sure your charts are done by the end of the day? What does success look like for these things? And it's going to be like 3 to 5 things that you have for them to do. Each one should end up having a measurement of success for that you're going to be happy and that they're going to know, okay, I did a good job because I did this. Right? So you've got to be able to measure it.
When you said charting, like actual patient charting, I know it's hard to imagine how they do it. Otherwise, they'd have to be on the appointment with you, right? Like that's not something.
Yeah, so generally, when we use a virtual assistant for charting, you can bring them in on an iPad, on a Teams meeting or a Google meeting. Just put it between you and the patient, and they're listening to everything that you're saying, they're listening to everything the patient is saying, and they all have access, once you have a web-based EMR, they can put it into the EMR in real time, and then chart that for you. Afterwards, if you need to place orders, they can get on, the orders, labs, place orders, they can call the pharmacy, they can place orders, they can do all that in the chart as well. So.
Do you know a lot of your VAs do ordering supplies and kind of managing what the practice needs?
They can order the supplies, yeah. So I have my VAs get on Amazon and order stuff all the time.
Mm-hmm. Do they track inventory in any way, shape, or form so that they know that you're out of paper for your tables or those sorts of things? Or they can only track it if they know that you're using the last one, you have to be telling them, of
Yeah, you typically have to tell them unless you have an online inventory system, but
Yeah.
most small practices don't. So whenever you're running low on stuff, you can always just tell them. So with this, you're ready to start hiring somebody already. You have everything that you need to start hiring somebody. Now, what you want to do afterwards is when you start having people in, you want to really make sure that they're going to be a good fit for you, right? And this is working for local people as well as virtual assistants. I do all of this with my virtual assistant already, so you guys don't have to. But even if you're hiring somebody locally, this is stuff that you should be doing here, right? Very simple spelling and grammar, super important. There's spell check nowadays, but still, you gotta make sure that they can spell and give good grammar. Virtually, we have a test that we put them through that tests their spelling and grammar and English vocabulary and everything like that. Math is super important as well. If you're collecting money, you need to make sure that you're collecting the right amounts. If you're doing any calculations for dosing or anything, you've got to make sure that you're calculating the right amount as well. So having a math test, super important as well. Doesn't have to be anything complicated, right? But if you're doing membership, right? A patient's monthly membership is $149. They paid $100. How much do they still owe? You'll be surprised how many people don't know that answer and see, right? So simple math questions that you can do just to make sure that they know the answers, that they're doing the math and see. Very simple testing that you can do here. Next thing, really important, typing test, right? You gotta make sure that they can type. They're not doing this, right? And see. So very free test, typingtest.com, you can go in there. Everybody can take the test and see. All right, the minimum that should be having is at least about 50 words per minute. That's decent. Our virtual assistant threshold is 60 words per minute, so we already test all of that for you guys. But if you're bringing somebody in locally, make sure you sit them down on the computer, make sure you test them out, and make sure that they can actually test, right, and they're actually typing well. Discover how you work best. Go to this 3 strength testing test. I recommend everybody do this yourself personally. We do this for our virtual assistants as well. But it's called highfivetest.com here. It's a great test. It's free as well. There's a paid version which is even better. It'll give you like 20 things that you're strong at. But it basically tells you what your strengths are. The reason you want to know what your strengths are is so that you can cover your weaknesses, really. You don't need to hire somebody who has the same strengths as you. Skills can be taught, strengths cannot. That's how people grow up. They're just going to be stronger at certain things. Some people are introverted, some people are extroverted, some people are more detail-oriented, some people are more execution-oriented, right? And see, so finding out what their tests and what their strengths are is really going to see if they're going to be a good fit for you and see if their strengths complement your strengths. And we test all our virtual assistants to make sure that they have great strengths as well here. All right. For example, this is mine. So it breaks it down into 4 different categories: thinking, feeling, motivating, and doing. All right. So me, as the CEO of the company, I do a lot of thinking. That's my strength. You can see I suck at doing things. I'm very bad at that, so I need people. That's why I got VAs to help me do everything, right? So if you're looking at the virtual assistant, their doing will be up here, right? And so it kind of flip-flops around, and you see what their strengths are and see what they're good at doing.
So are you saying that of your staff that this is like a part of their profile?
Yeah, so when we're interviewing and we're recruiting, everybody has to take a test and see. If it doesn't fit the profile, then we're not going to recruit them and we're not going to put them through training. You guys need people who can execute and do what you say, right? And see. So that's really what the importance is of it as far as that goes, right? Feelings is great for like customer service, right? If you want a customer service person, you want them to be empathetic, you want them to be able to connect with their patients, you want them to answer their phones and connect and get to know the patients really well. So that's important as well, right? So just depending on what the position is, we find people to fit that position. We find strengths that match those positions.
Is this test like valid? Do you believe in it? Like, if somebody answers these questions, that they're truly in that, fitting in those domains?
Yeah. I actually got this test, it's a free test. One of my clients actually gave this test to me. She used to work at a Fortune 500 company in HR. And every time she did a hire, she used this test. And see, so she gave me this tip, which is fantastic. And yeah, it really helps our virtual assistants placing. Now, once you have recruiting and you kind of have a good fit and you kind of know what their strengths are and whatnot, then you really want to interview them, right? And see. So virtual interview, you can always do a virtual interview first. Then when you're interviewing, you always want to ask open-ended questions. You don't want to ask yes and no questions. Those are easy questions to do, right? So tell me about a time you had to handle a difficult patient situation. What would you do if you made a bill in handle, right? Yeah. So things that you want to do are open-ended questions. Listen for problem solving, so give them a problem and see if they can figure it out and see how they would figure that out, right? What would you do if the patient was angry on the phone, right? And see. And then once again, the last thing is the trial period. This varies by state, so check your state if you can do the trial period. It could be paid or unpaid. I believe in California it has to be a paid trial, but other states you can do a free trial with them and you see. And it's usually just like a couple hours in a day, you just work with them and see. For Crew VA, our trial period, we actually give you 2 weeks. So if you work with the virtual assistant for 2 weeks, make sure you're going to be completely happy with them, make sure you're vibing, you're chatting well, you're executing on what you're telling them, you're picking up what you're teaching them, right? So local versus virtual. I want to give you all the guys, all the tools that you have, and this can apply to anybody really. You can apply to local hire, which you just did, you can apply to virtual hire, which you just did, right? But what you really have to focus on is what your local MAs should do, and then what your virtual MAs should do, your virtual VAs, let's say. Local MAs focus on high-touch, in-person, revenue-generating tasks, right? Local hire is expensive. You're going to be paying them $20, $25 an hour to make sure that their hour of their work is actually benefiting your physical presence. So, rooming and vitalizing patients, assisting you on procedures, injections and other procedures, accepting in-office payments, which are virtual. We actually have practices that do that with virtual as well. But let's see, in-office sales and upsells, things that can only happen in the clinic, inventory, for example, you mentioned, right? That can only happen in the clinic, so get a local MA to do that for you. The rest is really virtual assistants, right? As I was mentioning, on average, $20.84, that's countrywide. I think in America, in California, it's a lot higher. Yeah, $25 an hour. And see, and the unfortunate reality is that close to 60% of your medical assistants typically leave within 1 year. And that's not anything. I mean, in America, the medical assistant position is really a stepping stone, right? You want them to do better. They're going to go to PA school, they're going to go to nursing school, and then they're going to leave. They're just here to get experience, right? And see, so that's an unfortunate reality. Here, it costs approximately $14,000 in lost productivity to kind of cycle through that. If you're going to cycle through that every year, that's costing you $14,000 every year to cycle through that. Not to mention that you have to do benefits, PTO, recruiting, onboarding, training, all that stuff that you have to take care of. Right. Medical virtual assistants, they're real people, they're just based in the Philippines, and they're typically medical professionals. There's registered nurses, pharmacists, lab techs, physical therapists, insurance specialists, medical coders or billers, anything that you need. You just work remotely from the Philippines, and we use the Philippines primarily because the English is a lot better. Another common option that people will go to is like in India or in Bangladesh, but they speak more British English. Their accents tend to be a little bit stronger. The Philippines uses American English more, so they tend to be a little bit more easier to hear for Americans. Right. The other thing is also HIPAA compliance. The Philippines has what is called the Data Privacy Act of 2012, so it almost mirrors exactly with the HIPAA and high-tech acts that we have in America. So it's a lot more strict as far as that goes. We HIPAA train and certify all our virtual assistants as well. On a yearly basis, we recertify them to make sure that they're good with that. And we also run background checks with the government, the Philippines government, to make sure everything is good with our virtual assistants as well.
Have you considered, or is anybody doing like in Caribbean or South America?
Yeah, we've actually opened up Colombia, so we'll be launching that before the end of the year. We have Colombia for Spanish speakers, if you need Spanish speakers.
Okay.
Cost of living is a little bit higher in Colombia, so cost goes up a little bit compared to the Philippines. Okay? And see, and the staffing that you need it depends on your practice, so there's no one size fits all in DPC. Here's how you want to think about it. If you have a micro practice, if you're under 150 patients, you probably don't need somebody full-time right now, okay? You can get a part-time VA, about 20 hours a week to help you out with scheduling, patient portal messages, billing, social media, all this stuff, all right? I'll save on some costs. If you're growing, if you're at 150 to 400 patients, like your panel size, probably need a full-time virtual assistant at that point. You're going to be busy. Patients are going to be looking for a lot more assistance, so helping out with more inbox portal management, prior auths, collection, membership management, all of that stuff, right?
Do any of the levels coordination to the degree of contacting specialist offices, getting records, coordinating appointments for specialists and things of that nature?
Yeah,
All
absolutely.
levels? Okay.
Sending medical records out, contacting specialists, faxing medical records, all that stuff can be done, right? This is just to kind of help you frame more and more of time commitments
Okay.
that you'll probably need in your
So
practice.
they'll work at our office hours when they're connecting with specialists,
Yeah.
stuff like that.
They work 8 to 5, or whatever hours you set.
Okay. Are there levels though of pricing if you're needing things like that? Because coordination is a big thing. I think the phone calls, scheduling, and things like that are great, but I think the thing that sets us above is being able to connect patients with if they need an appointment and are not getting through to the office themselves, or getting records and things like that. So all of that is included in just a tier.
Yeah,
Pricing
it's all
is the
included in the tier. Our pricing basically mainly works on time commitment.
Okay.
So you get the same person working for you day in and day out. It's always the same person. And see, our pricing is basically $9.95 an hour, and that's for 32 hours a week. You can go all the way down to 20 hours. That's part-time. Part-time is just a little bit more expensive. It's $12 an hour.
20 hours the minimum.
20 hours is the minimum. Yeah.
If you want somebody who has more social media experience or that kind of, does that charge more, or do you just let you know this is what we're needing and then you would
Yeah, it's a good
do it
question.
that way?
So depending on where your social media growth is and what your strategy is, we have basically 2 different options for you. One is you can get a virtual assistant to work with you 20 hours a week to do social media, or 32 hours a week to get social media. The other option is we actually have an in-house team. So we have a video editor, we have a content strategist, we have a graphic designer, and we actually have a package program that we put together for you that's $1,000 a month, and then they'll post 20 times in a month. They'll handle all your messaging, they'll handle all your scripting, they'll develop all the content for you. You just have to spend basically 2 hours a month recording video, and then they'll handle the rest for you as far as that goes. We did that because basically, there wasn't enough work for 20 hours on 1 week, on a week-to-week basis, unless you were being really aggressive with your social media. It wouldn't make sense for a lot of doctors. So we ended up creating an in-house team to help everybody out with that.
I think I read on your website that the hours can be spread even over the weekend should you choose. So that can be like
Yeah, you set the hours. If it's part-time, usually you just do like 4-hour blocks, or however you want to do it, so 8 to 12, 4 days a week, or 5 days a week. That makes 20 hours. So however you want to cut up the time, that's up to you. Yeah. And once again, they're dedicated to you. So even if they're working part-time, they're not working with any other office. And so that's why it costs a little bit more. So whenever you're starting to grow and get a little bit busier, you can just increase the hours, and you're not having to fight the time with another doctor. Say, oh, I'm getting busier, but you're splitting the time with somebody else. This becomes a problem. So they're dedicated to you no matter what.
What if they didn't want to work full-time? How would that be negotiated? Does that come
Oh,
up?
so we make sure that they're okay with that situation.
Okay.
The hours that they're not working for you, they'll come and work for me, basically. I add crew and then I basically top up their hours and see until you guys are ready to expand, is basically how it works out. So I bite the bullet on that one. Yeah.
What kind of social media company do at the kind of medical, let's say you do the 20 hours of the medical virtual assistant, I know that's the kind of in-house $1,000 package, but can you give us a sense of the expectations that a medical virtual assistant could do for this social media?
If you're getting a medical virtual assistant,
Yeah.
so somebody like a nurse,
Yeah,
their social media will be more basic,
okay.
right? So they can get on and respond to DMs, they can post stuff for you. They're probably not gonna be able to video edit for you, that's a different skill, right? They're not gonna be a graphic designer or anything like that, right? They didn't go to school for that.
Okay.
Yeah, but they can, go and request Google reviews, they can comment on the DMs, they can check everything out,
Okay.
make sure. But because you always get the same person working for you, you could train them potentially as well. If you have time, you could train them to do whatever you wanted them to do.
So
Yeah.
you said there are different people with different skills, but we get one person who does everything. So it's not like we're talking to different people with.
Yeah, you're gonna get one person, I should clarify, one person who would try and do everything. They're not gonna be a rock star at everything. That's it. So depending on what your needs are, we'll find the right person for you. That's why we did the exercise is really finding what are the top 1 to 5 things that you really need help with first, and then we can find somebody who's gonna kill it at those things for you.
For the part-time thing, I mean, so it's 20 hours a week. So if, let's say you do 4 days, 5 hours per day. Would they come on at different times when you have patients, or would they be only, okay, I'm like here from 9 to 1? That's pretty good.
Yeah.
If you have patient 4, sorry, my time's not on.
Yeah, so usually it'll be a block time.
Okay.
And see, so either you can set whatever block that you want,
Okay.
whatever 4-hour block that you're comfortable with, and you can change it week to week.
And that can change.
Yeah,
Okay.
and that can change on a week-to-week basis, right? It's just because if they come to work for you, then if there's no schedule, then when they come to work for me, it's kind of difficult, right?
Okay.
So we just share the time, and then when you're ready to grow, you can take all the time you need.
Well, I communicate with my
Oh, yeah. So a lot of great options. We're actually about to launch our in-house communications portal, so we'll give you a portal that you can communicate directly with them. That's going to give you a text, a number that you can text them, email them at. They all have WhatsApp as well. If you guys use WhatsApp, you can communicate them through WhatsApp. Or if you guys use Google Workspace, you can use Google Chat or something like that. Or Slack is free, and you can just set up a system with them. We have time tracking software that we install on their computer, and see which, like you say, it monitors their keyboard clicks, it monitors their mouse movements. It does take screenshots of their screen as well. It's just blurred out for HIPAA purposes. And then so if they're not working, if their keyboard doesn't move, I think it's for 6 minutes, then it's automatically going to stop tracking their time and see. So, and we build down to the minute, so they're very motivated to keep working as far as that goes.
But what if there's no work to work on? So if they're working 4-hour blocks,
But I can easily see a practice that it's 150, 160, them only typing for an hour of that time. So then where do the other 3 hours of that 4-hour block go? Do they extend the day?
They'll extend it. I mean, they'll come and ask you, hey, doc, I finished up my tasks. Is there anything that you need me to do? Do you need help with something or anything like that? And then they'll find stuff to fill out the hours.
You communicate with them and say at the end of the day, you know that these things are needed to be done tomorrow. Can you just let them know, hey, I have these, or whatever method of communication we're using. These are the tasks for tomorrow. And you can just tell them, and when they come on, because they will only work the time slot, right?
Correct.
Their time slot is 9 to 1. At 4 p.m. today, I can tell them, hey, okay, I need these things to be done for these patients for tomorrow. And they can come on and they'll see the message. Is that something that's
Absolutely. I love exactly what you said. That's exactly what you can do.
Okay.
You have a to-do list for them, just send it over to them. When they clock in the next day, they're going to start working on it. And see, at the end of every day, we have them send out an end-of-day report as well, so then you know exactly what they did at the end of the day, too.
Okay. Can you just help me to understand this billing down to the minute thing a little bit more? Just because even my own medical assistant, if she's there for 8 hours, some days there's just not a lot to do. So I guess I wonder if a person is set to work for 4 hours, but they've only clicked to bill for the 2 hours, then does that day become a 6-hour day, or do they stay until they've clicked?
We do have a 20-hour minimum, so if you don't hit the 20 hours, we will still go for 20 hours.
I see.
If say you already have 25 hours for that week, does that extend the day for that particular day where they're only doing 2 hours and they don't really have a lot of work, and then you kind of give them work later? Is that what you're talking about?
Yeah.
Or is that time commitment block set? If that person's supposed to work 9 to 1, but you only give her work 9 to 11, but if you decide you have additional work later, there's no like them taking a break for 3 hours and then you filling another 3 hours in later.
You can extend their work shift, that's what you're asking?
Yeah.
So let's say, for example, it's 8 to 12, right, and then you wanted them to work an extra 2 hours, you can extend the work shift
Okay.
and see, yeah.
But then you would pay for the block of time in the middle where you don't necessarily have work assigned, or does the clock start back up after that break of time?
Oh, I get what you're saying. It would start back up when the shift started again.
Okay.
I see, yeah, I see. But you just asked for, because they were coming to work for me, right? Then I just asked, hey, just give me notice that's going to happen, right? So then I can adjust my tasks to make sure that it accommodates you guys. And see, yeah.
So, a lot of us that are gonna be sole practitioners are like, kind of have a business, but also we're like CEO of our home and things.
Yeah.
Is there, can we do non-medical tasks that
Yeah,
you would have
absolutely.
workings and stuff for?
Absolutely. My virtual assistant books my hotels when I go give talks, books all my flights when I do that. They get on Amazon and order me stuff. They order my lunch for me every afternoon, so I don't have to think about that. You know.
Let's say next week, they're going to be working for me. Monday, I only need 2 hours. Tuesday, I need 8 hours. Wednesday, I need 4 hours. Can I give you that in advance and you can incorporate?
Yeah, usually a week in advance.
A week in advance, and then, so you can vary that, but just give an advance notice.
Yeah, exactly. Yeah.
So, as long as it's hitting the 20-hour mark,
Correct.
that's what counts. So you
Correct.
can have different timings for each day, like
Correct.
different start time for each day.
Correct.
Can I ask how many VAs you have in your office?
Yeah, we've placed over 800.
Over 800.
How long have you been?
4 years now.
Vacation time, like if we were to leave for a week, how much kind of help and coverage are they allowed to do?
Yeah, so we provide them with, after 6 months, we provide them with 6 days of PTO,
Okay.
which they accrue over time, and we have 6 paid holidays for them. Everything like New Year's, Christmas, all the major ones. And see.
But when we take a vacation, how much can they kind of do like their own autonomy if we tell them with guidelines, okay, you need to just keep the phone call, you're watching the phone calls.
Oh yeah, the office can keep running.
Yes.
When you're not there. They'll continue to answer their phones, they'll continue to take care of the messages, inbox, all of that stuff, so you can go to the Bahamas and have fun. Right?
And I think I saw that if they are on vacation, then your company provides somebody in their place. Like on a vacation day, your office is not going to be left without somebody to cover.
So if the virtual assistant wants to take a vacation, we tell them, like, give us some month advance notice, and then we'll find somebody else, train them up for about a week, and then they can plug and play, which I don't think any other company does that, but I understand, like, you know.
And what if the virtual assistant has an emergency? Death in the family.
Yeah, that's a little bit tougher. And see, if they miss a day, or they're sick or anything, theoretically we could place somebody with you, but the amount of time it takes to like onboard, get all the documentation set up is typically just not worth it. Yeah.
And then the MA's leaving often, how does that problem get solved with the virtual assistant? Or
Yeah, so the
Once you
thing
find
is,
one you
with
like.
virtual assistants, they get paid really well. And this is a career for them in the Philippines because of that. So our oldest VA in the clinic has been with us for, I think, going on 8 years now at City. And then, yeah, we've included VA, we've had them since 4 years. My first client still has a VA. So it's a lifelong career for them. It's not just a stepping stone to a better opportunity for them.
unusual to need to replace them.
Correct, yeah. It does happen, say there's a death in the family. It is a third world country, so something could happen. But I think our rate is about 80% retention. So.
And my understanding, which I guess I could Google this, but the time difference. Like, first of all, is the country of the Philippines all in one time zone?
Yeah, the country of the Philippines is all in one time zone. It's about 15 hours time difference from here, from
They
California.
manage American work.
They manage American work hours. It was interesting. I was really worried about their health at that point in time as well. But that's part of our training program, is to make sure that they are healthy and capable of doing it. And then what I came to learn was actually there's a very big nighttime culture in the Philippines, actually, because the daytime is so hot and nobody actually wants to work during the daytime in the city. So a lot of them just rest during the day, and then nighttime's a lot cooler, so that actually it's easier to work. It's actually more efficient for them to work in the evening time.
Are they working from home?
They do work from home.
Okay.
Yeah, they have a private room in their home, and we make sure, and then we do cybersecurity checks on the computer on a quarterly basis as well.
And are you selecting the VAs for the particular offices, or are we interviewing to agree and selecting the ones that we
Yeah, you can
feel
interview
fit
them.
best?
Yeah, so usually we'll jump on the calls and make sure what you're looking for, and then we'll send you some candidates, some resumes. You can review them, pick ones you like, and then you can set up an interview, and then do everything I taught you.
And how long is the contract?
Our contract is week to week. Yeah, most people are month to month, or they're locked in a 3-month contract, actually, but yeah, we're week to week, super flexible.
And I know you said yes to this before, but the answer just blew my mind. We really can have the kind of CEO of our life. I just feel like at this time of year, there's all these camp schedules and the kids and ordering food and planning things and trying to set up my practice on and just saying all the stuff I have to do. I feel like someone that is essentially virtual assistant and medical, so I need both.
Yeah.
I have zero patience, so I'm scheduling reminders, but I currently need both.
Yeah, absolutely. We call the second part really more of an executive assistant, right? For your life. And so they take care of everything in your life for you, so you can really focus on, let's say, being a mom, being present,
Yeah.
right?